I decided to become a certified nurse midwife after I'd been a labor nurse for about 20 years. I'd worked with a lot of women and families and really enjoyed the birth process a lot, but I saw that there was more of a disconnect happening with women and the care they received because of the advent of more technology. And so people were getting monitored more extensively, and I saw people being cared for, but cared for from a distance. And by that I mean that nurses didn't have to be at the bedside caring for patients and working with them through the birth process, but were able to be more removed. I think that many women are curious what's going to be the difference and what their birth might look like if they choose midwifery care through Orange Coast Women's Medical Group. And I think that's really an important thing to talk about. There's many standards of care that we all adhere to, whether you're a physician or a certified nurse midwife. And that means that during prenatal care, we do all the standardized tests and offer all those things, ultrasound and listening to your baby's heartbeat and making sure your baby's growing appropriately and offering you any genetic testing that would be appropriate based on your health history or your personal desires. You're in active labor and you've chosen to work with a nurse midwife through the Orange Coast Women's Medical Group, you'll be accompanied by that midwife when you're in active labor, who will be at the hospital with you to support you in your decision making and to provide direct one-on-one support and care to you during your labor. And then that will unfold into being there to provide that care to you during your birthing process, meaning that we help you with the pushing phase of your labor, facilitating different positions, allowing you to get up and move around, because we know that when women are active in labor, their perception of pain is less, their labor progresses better many times. We also have the ability to provide you with water immersion. They have lovely tubs at the hospital where you can be in the tub submerged in water where pain perception is much less. You're able to be buoyant and assume different positions of comfort based on your needs. And we use aromatherapy, massage, and other things to help you make the birth of your baby the way you want it to be. And then we make sure that that time right after the birth is very important, where that baby's on your chest, that you are breastfeeding immediately after birth, and that you are able to move into the role of mother and parent seamlessly. And I think that those are some of the differences that we offer as midwifery care unfolds here at Saddleback Hospital. One of the most amazing births that I had was actually a few years back, and a woman was having a natural birth, a non-interventive birth, and she had had 2 other babies with extensive medical intervention and wasn't sure how she was going to be able to do that. And her husband was unable to be at the hospital when she came, and she had her 4-year-old daughter with her. And it was one of the most tender experiences I've ever seen. This little girl came by her mommy and pulled a chair next to her bed and was just stroking her hair, telling her, you're just doing so well, Mommy. And then it came time for her to push and have the baby. And I said, you're going to have the baby. And the little girl looked down and she says, yep, Mom, you're just going to have the baby. And was just so loving towards her. I've never seen a child, and the way she was stroking her mom's hair, and then the baby came up onto her abdomen, and the little girl was talking to the baby, and she cut the cord, and she was just so involved. And so I guess that I would have to say that that was just one of the top experiences in my midwifery career. I've known many of the physicians and nurse practitioners of the Orange Coast Women's Medical Group over the past 15 years, and I've watched it evolve and change and people come and go, but I really applaud them at this point in time because they've been bold enough to and willing to go out on a limb and offer midwifery care to the women of Orange County. And that is not available at any other local hospital, and they've really made a commitment. It's not just on paper or just said that you can get midwifery care here. They really honor and respect what I'm here to do and to promote midwifery care for women of Orange County.